Okay, we're here with my patient Ken, who has been having some back trouble. What's going on, Ken?
I was walking from work yesterday, walking out, and my back suddenly just shifted, and I noticed it, and I didn't think it was out. And then later, 2 hours later, 3 hours later, it got super, super stiff. It was hard to move, so I was able to get in, and you worked on me yesterday, and really released a lot of the tension and a lot of the nerve pressure. So I'm just back for a follow-up today because I want to make sure that I'm doing well.
Cool. All right, let's see what we can do. We've already assessed what's going on with his back. I know that he primarily has some issue in the low back and in the sacrum, particularly at what are called his SI joints or sacroiliac joints. And that can be really problematic for a lot of us. It's sort of the base of the sacrum or base of the pelvis, really part of our center core being where we talk about strengthening the core. We also need to worry about our pelvic bones. And when those aren't really aligned, then we can have a lot of pain that kind of radiates up, radiates down. It can be the source of sciatica. So we're going to start working on him a little bit. We're going to take a look at his back. And just by feeling here, this is the beauty of osteopathy, is that just by feeling a bit, is that we can figure out what is going on. So he's got some tension here on the right. Yeah, it's just a lot on the right. Is that where you're feeling it?
Yep.
Yeah, okay. Ready, go. All right, so we're just kind of feeling along here. And a lot of times you can actually see how the skin reacts. So if we kind of come down with our thumbs, now where I can feel, even just from doing that little motion, I can feel that there's an area of irregularity here. It's kind of more tense. You can see that this is more full on this side, and as time goes on, you'll actually see this kind of highlight red because the body's really already pretty upset at that spot. So this is about L1. A lot of times we have issues between the transition points between thoracic and lumbar and lumbar sacral regions. So those will be some trouble areas for patients a lot of times. All right, so we'll kind of work here, get some of this soft tissue done. And we're working primarily at the upper portion of the quadratus lumborum, which is the muscle. It's a huge quadratic type muscle along here, going from the lower thoracics to the upper portion of the sacrum. And some fibers in there can really be problematic.
Right there around the money.
Yep. And then we've got the ILS bands of muscle as well that we're going to kind of work out here. And we want to go perpendicular. The muscle fibers go this way. We want to pull out perpendicular to those muscle fibers and get them to stretch out. Yeah, he's feeling it. So we've been working on Ken, and we've gotten quite a bit of this soft tissue stuff worked out here at the ILS, and it's kind of at the lateral transverse processes on the right of his lower thoracics and L1. I'm now going to go out to the lateral aspects of this quadratus lumborum, kind of work on these fibers a bit. And kind of just knead these guys out. So now I'm going longitudinally or parallel to those muscle fibers. Remember before we were kind of pulling out on the ILS muscles, and now I'm kind of rubbing on the parallel aspect of the quadratus. And then what I like to do here is just a lumbosacral release, where you basically place your elbows, one at the upper pole of the sacrum and one at the lower aspect of the ribs or at that thoracolumbar junction, and kind of just applying some gentle downward and outward pressure. So my elbows are actually pointing outward like this to get those that quadratus lumborum to settle down. And we'll go through this for a couple of respiratory cycles and breathe in and out. Every time your patient's breathing in and out, we're kind of gathering up a lot of those toxins and then letting them go to allow this tissue to heal. Great, I think that'll do a little bit here. Is this better?
Yeah, that always works. It works really well.
And then I like to come down here, and this is an area here at the SI joints that a lot of people are really reticent to treat. It is a very personal area. Obviously, it's where the buttock is. And that can be sensitive for some people from a cultural standpoint, a comfort standpoint, but really this is such a mastery of muscles in here. You've got your gluteus minimus, medius, maximus, obviously, but you've got your gemelli, you've got your piriformis muscles. So all of these things are hanging out in here and really being neglected, and they're so critical. Remember that you've got your gemelli muscles and your piriformis muscles coming from your sacrum out to the greater trochanter, and any tension along there is going to affect your sciatic nerve that comes out from between those gemelli, or the twin muscle bellies, and comes down the whole back of the leg. So because of your lack of comfort or the patient's lack of comfort, then you're really not treating a critical area in being able to alleviate a lot of those symptoms of sciatica. And it's a matter of just communicating that with your patients and getting to that comfort level to where you can actually get in here and treat this. Is that the spot, sir?
Yep. Right there.
Yeah, and I love this upper part right where the sacrum joins up with the iliac crest. This is a super sensitive area right in the concavity of that ilium, kind of the upper pole of the sacrum. Really, really important area. And Olivia, if you could like hone in, if you could see, remember we talked about those reactive areas, and if you could see here, see that redness there and this redness out here, and it's telling me how responsive his tissues are to just what we've been doing. I'm actually applying a fair amount of firm pressure, but really not agitating the skin so much. So this is really just reflective of what's going on inside. Yeah, that shows up pretty good in there. And remember that gluteus medius, gluteus minimus come out and make our IT band. This IT band is also an area that can be really exquisitely tender for so many people. Can then lead to knee pain, lateral knee pain, and even ankle pain as it comes all the way down. So really important to not just treat the area where they're having an acute issue, like here is where Ken was having an issue, but really coming just above and below. We always say look a system above and a system below in order to really address that full area. This other area here that can be really sensitive, let's see if I can get him to yelp about it, is that posterior aspect of the greater trochanter. Yeah, right there. And so again, this is that insertion point from those gemelli muscles and the piriformis, and the sciatica coming out right about here. This will be another tender point, kind of right in the belly of that piriformis, right in between the gemelli. But then where those muscles insert into the greater trochanter can be a really, really tender point. How are we going to manage this? So yesterday I treated this side, right, Ken? Mm-hmm. So we're going to treat this point now. Is that painful right there?
It's starting to be.
Let's see, we'll find it. Let's see if we can locate it here. Right there. You see him twitch a little bit. So is that sensitive right there?
A little bit, yeah.
Okay. So this is a 10. So you want to kind of identify what is that pain scale. Obviously you don't want them to be a 10 out of 10 pain, but you want to give them some perspective. So now this is the worst pain because I haven't done anything to it. So can you appreciate that? That this is kind of the worst?
Yeah.
Okay. So what we're going to do is we're going to really shorten this area.
Pardon my feet, I had sandals on today.
Okay. How is the pain here now?
That's better. It's, you've relieved some pain.
Okay, so on a scale of 1 to 10?
3.
So generally speaking in this technique, how is it now?
4.
Okay, so we want to come back a little bit than we were. How about now?
3.
Okay, so we want to get this pain level to about a 2 to 3. If you'll notice, I have not moved my hand. Okay, so we have not come off of this spot at all. This is a strain counter strain technique. We're basically finding that area of strain. We're applying then a counter strain, or actually putting it into an area of ease. This is an indirect technique. And I'm waiting for tissue changes underneath my thumb. So what I'll feel happen is it'll first get very, very warm. I almost feel like there's a little Bunsen burner under my thumb here. and then I'll feel the tissue kind of oscillate. It'll sort of rock back and forth, back and forth, back and forth, almost as if it's trying to figure out where it's supposed to go. And then at that point, it's gonna, all of a sudden, you just feel the tissue breathe. And you'll also see that match with a patient's deep breath. So when that tissue is ready to release, the patient almost gets that intrinsic need to actually like breathe in and out. It'll be a pretty big breath. So we'll wait for that to happen. Okay, so we've waited for these tissue changes here with this indirect strain counter strain technique. We're at the posterior aspect of the greater trochanter. It's a really significant tender point. So right now it's like a 2 out of 10 pain. I have not moved my hand at all. It's staying in the same spot. So important with this, you want to instruct your patients not to help you. Just relax your leg. And I'm going to put him back into neutral position. And now how is that pain compared to when we first started? A lot better. So again, as much as he was having pain here at the quadratus, really it comes down and those fibers attach right to where my thumb is. So there's still some feedback here between the two. So even treating here, I'm actually helping this area as well. So the best approach isn't always just dig, dig, dig right in the spot where the patient is identifying the pain. You'll often find compensatory injury or compensatory pain. And you'll also oftentimes find it on the opposite side. So something to be really aware of. So I hope you learned something. Make sure to comment down below if there's any other techniques you'd like to see. I'll be happy to show you.